of experience in leading healthcare operations. Currently, Olga serves as the manager of division care at UOACV in Aruba, where she oversees strategic planning and execution of healthcare services. Her work focuses on optimizing patient care, enhancing safety protocols, and ensuring that healthcare systems meet the highest standards of quality. With a track record of successfully implementing quality management systems, Olga has played a significant role in shaping the future of healthcare delivery in Aruba. Her insights into operational efficiency and quality assurance are highly valued across the healthcare sector. Join me in giving Olga a warm welcome.
Thank you, Martha. Thank you. Bon dia. Good morning. First of all, thank you for having me here. I'm honored to be here and to see so much of my well-esteemed colleagues in healthcare. Yes, a long time in this sector has given me so much great minds that I could pick from and that I have learned so much from. Right now, I'm in the AZV, as you have heard, and there are new things that I have learned. 9 months have gone very quickly. The perspective of a jeweler, why? Our health is precious. It's strong, but it's fragile, just like a diamond. The jeweler has to have that perfect strength to shape it, to form it, to shine it. The same we do with our healthcare system. And I speak and emphasize it's about we, because it's every one of you and the other ones that are in the organizations that are helping us to structure and to give more shine to this beautiful healthcare system that we have on our island. In order to provide you the insights on how AZV looks at the healthcare quality, I'll give you some pointers on the frameworks, what we cover, and how we contract, because that's essential, where we can emphasize, where we can support and make agreements with you all, how we will be delivering the health to our patients. I don't know if you are familiar with this one, but these are the principles of the UOAZV, the Landsverordening, mandatory for all and available to all. That's actually a blessing that all healthcare, or all the other islands are actually very jealous of us. When we go abroad, and I have had the opportunity to speak with different people in the region, they're always asking, how did you do that? How can we get there? And I know there are some people that have been approached in order to understand what this universal healthcare is doing for us and how they can implement it. We provide also comprehensive basic health insurance package. It's a broad package. It doesn't have everything we want. We understand that, but we have limitations. The aim is to provide equality in access and quality of care, so everybody should be provided the same amount of care with the same quality. And we provided care in kind, so nobody has to really pay for it. And here and there are some co-payments, but that's not so much. Importance is that we all, as the working group, provide the finances and therefore the solidarity for contributing to this financial capacity. The AZV has been working some time now in a multi-annual finance system. What does that mean? We have looked into different data, microdata, but also external parameters to make a projection model. It's a model, but it gives us a pretty good insight from experience of what our healthcare costs most likely will be developing. We have, of course, policies. And although it's mentioned broadly that we have a surplus, still there are expenditure ceilings. And I'll show you those ones. For 2024, we will be aiming in a range between 2.5% to 6%. And this is an exceptional year. We want to provide in 2024 a little bit more in order to actualize as much as we can our healthcare on the island. We understand that that's not enough, but we have to grow slowly. In 2025 and 2026, the max will be at 4%. There still will be growth. As the minister already mentioned, we have in 2023 the healthcare agreement, SOC Accord, and that provides our direction. Where are we going to and what are we going to do? All the partners have decided upon this document. And there is, as he already mentioned, the priority for the first line, the eerste lijn zorg. Of course, there are other topics that also were discussed. The multi-annual financials is one of them. And there are some others that are very important towards our development. As I mentioned, and it's very important to notice, what are we giving is the coverage. The primary level, which we all know, the family physicians, very important, our gatekeepers, poortwachters, the midwife services, dental care and orthodontic. In the secondary level, we have the hospital services, physical, mental, the medical specialist services. And in the tertiary level, we have the hospice care, but also the medical referrals abroad, which AZV is in charge to contract and to prepare the whole logistics to send our patients abroad when the care is not provided on Aruba and when it's medical needed. All along the lines, we see that the prescription of drugs are being provided. Of course, we have had some years ago a cap where some medications that are over the counter are not covered anymore by the AZV. We provide the laboratory services or cover them, the physical therapy, speech therapy, and the ambulance services. In order to do that, the AZV has to have a relationship with healthcare providers, individuals, organizations. That's what we call the contracting relationship. I emphasize we are not the employer. We have a working relationship. We see or we identify the following phases: onboarding, the contracting itself, and the management. These are the main tools that the AZV has to emphasize on quality. What are we going to decide what is quality? What Jaybert mentions, it's different perspectives. Just like in the diamond with the different facets, the same goes here. We need those different perspectives at the table when we are talking about contracts, because we want to provide a better care, so we have to discuss this with each other. The onboarding, the requirements. When we are talking with the different healthcare providers, we have some requirements for in order to go into this phase. We want to talk about their diplomas. We want to know who we have at the other side of the table, that you have the experience needed. The AruBig, is therefore right now one of the most important instruments for the individual healthcare provider and also for organizations. It's important that each and every one of our healthcare providers that are being contracted also have the AruBig in place. Of course, we also have to do our due diligence. This means that we have to look around and see if there are claims known, if there may be legal limitations for a person or organization to execute the profession, because at the end of the road, this will also impact the services provided to our healthcare and to our patients. And continuous professional education. Like a good diamond, you have to polish it. The education is a good part of that polishing. You have to maintain the knowledge. And that's very important for each and every one of us, but surely also for the AZV that wants to provide that better care. And as I mentioned before, that we will contract with established organizations with a good track record. I think this is one of the most difficult phases, and as a contracting itself, because a lot of things are changing in healthcare. The quality parameters are not new to us, but we are emphasizing more and more on them, and each group has their own sets of quality parameters. We have to see what's according to the profession, what's broadly adopted, and so what can we expect for the end results. The professional standards is something that we really pursue. We put that also in different of our contracts. I think I've seen the HAVA here, and I know it's written on their contract also that we aim towards their group's professional standards, what is customary within the science, but also in the professional group. Those are things that we are working more towards. The professional accreditations, that goes a little bit more for the organizations, but we are talking to labs. We are so proud to know that on Aruba, all our labs comply with these professional accreditations. I know that the boticas are working very hard towards that, and that's great to know. We are very proud to know that IMSAN is already got their JCI, and the hospital is working towards it. So we see a lot of groups moving into that direction. And just as Jaybert mentioned before, it's very important that we all emphasize this same direction. The continuous education activities, for the ones of you that have a direct contract with the AZV, you know that when we talk about the working hours with the AZV, we will be speaking also about how many weeks of education you will have in every year. It's for us very important that each and every one of the healthcare providers get the opportunity to educate themselves continuously. A stimulus for cooperation. This is one that we have been speaking about, but we will be emphasizing more in the future. And that is that we see that in order to get better healthcare throughout our healthcare system, cooperation is not only needed, it's required. We need to be able to count on every one of us to provide that better healthcare. And we think that every one of you want to have that too. So we have to emphasize on that. And of course, every part of the healthcare system have their specifics. So a contract is very standard, but still very individual. But it doesn't end only with signing the contract. That's where actually when the relationship takes a formal status, and then we go into the management. The continuous conversations. the developments, exchanging of information of what are the needs, of what are the things that are changing, are very important for us also to understand where every healthcare professional group or organization is at the moment in order for us to be able to think about the finances and how we're going to approach that part. We have several common topics. One of them is diabetes, one common pathology on our island. Each and every one of you speak about it, but we need to have the big or over the organization's platform in order to put all those work together to have more efficiency, more efficacy, and to get to a better result for our patients. We are working more towards the KPIs, the key performance indicators, the certifications, so we will be enforcing that more and more, and we will be also asking more about that. So I know that's a topic that some of you do not really like, but we have to be accountable, and we understand that part. The ASFV is a funds, and we are working towards a better maintenance of these funds for our island and our healthcare. And therefore, we need accountability. When we provide the finance and we have an agreement about certain goals, it's very important that we maintain this dialogue to see where are we with our goals. What are we going to do with them? Where do we have to deviate? Are there over expenditures? And why? It's very important that each and every one of us is transparent, because only in an open dialogue we will be able to form a better future, like the diamond. We will be shaping it, we will be forming it, but we have to do that together. And of course, the main important actor in all healthcare, the patient. The patient, I've mentioned it last, not because it's the least important, it's the most important. And I want us to put special attention to it. Because it's not only giving a certain service to a person, it's a person with feelings, it's a person with needs. And every one of us healthcare providers know how important it is to look at all the dimensions of this patient also. It's important to work towards their satisfaction, but also to take their complaints seriously. It's our island is small. Our patients are very scared of us, and I know you know that. They are scared that if they may meet us tomorrow and they have a complaint today, that if they tell somebody, that they will be retaliated. It's incredible, but it's true. And they ask to not provide their name. Some of them, of course, we're all humans, and it's emotions. But it's very important to take it seriously and to see what we can do in order to improve our healthcare, to provide a better place for our patients. And I'll be starting with my conclusion. Quality is a group effort. I mentioned that before, and I will still mention it again. We need each and every one to be on board, to provide the information, to work together, to inform, to be proactive, in order to get to that quality that we all desire. We are humans. And as mentioned by Mariana, it's trial and error. And we have to learn from those mistakes. It's no shame in making mistakes. The shame is in not recognizing them and not working on them. That goes for all of us. And of course, report them, because that's the only way that we will learn collectively out of it. It's a continuous balance. money, quality, individual service, collective service. There are a lot of interests, a lot of facets, like in the diamond. But we have to come to the conclusion that there are limits, and we will have to gather, we have to shape towards where we're going in order to get that balance that works out for Aruba and for our citizens. The open dialogue. Speaking with each other, not about each other, and trying to get to results, not blaming. It's so important that we open up and that we go towards that next level. The accountability, it's essential. Surely coming from insurance, we have to know where that money is going. We feel it's our responsibility that the collective money, that the money that comes from our citizens will be used in the most proper way. We have to be accountable for that. And we count on you to help us do that. There are always innovations, great innovations, artificial intelligence, robots, name it up. We have to also look what can we do and when. And what goes first. If I may recall SOAR Accord, it's one of the important points is how to keep the current structure. Personeels behoud. So we need to strengthen the people that we have, the structures that we have in order to provide better care. And from there on, we will be growing to new frontiers. I've seen that there are some sustainable development goals that are most relevant to my presentation, which is of course the good health and well-being, having a universal coverage and equal treatment is being represented by it. The clean water and sanitation, hygiene is so important in the healthcare sector. It's undeniable. The partnerships for the goals, as my presentation aims towards that collaboration that we surely need. Good health is the most important thing. More important than success. More important than money. And even than power. If we don't have health, we cannot achieve anything. That makes you special. Because we all collaborate to get that to that greater good for all our citizens. And we count on that. Thank you.